All right. All right. My name is Alan Rasmussen, and I have to say I'm glad to be here today and be part of this presentation. I love the working together with the Mental Health Association. We've had a relationship for a long time, and good things happen when we come together. So thank you, Renee, and thank you, Stephanie, for having me here today. Just a little background, and I don't want to overdo this, but I think it's important to know. If you don't know me, I'm a prevention specialist for Rappahannock Rapidan Community Services. I've worked for that organization for 18 years with a focus on mental health, suicide prevention, and substance abuse prevention. I am also employed with National Counseling Group as a community counselor, doing crisis stabilization, home-based services, intensive in-home services, and am board of counseling license as a qualified mental health professional, able to work with children and adults. I also am a professor at the University of Virginia for the Bachelor of Interdisciplinary Studies program. And interestingly enough, I now teach 3 courses, having added a new course for the fall semester. The new course is on mental health disorders of modern society. So it's going to bring in a lot of what we talk about and do in our communities. And I also teach 2 criminal justice courses because I am also a retired chief probation parole officer, having worked for the Virginia Department of Corrections for 28 years and having retired in 2003. So with that said, I'm going to turn this over to Renee for her to talk, and then we'll move on with the presentation.
I had to unmute myself. Good evening. I just heard rumblings of thunder, so hopefully we will keep our internet up. But thank you so much for joining us. When we planned this talk, we didn't realize that Fauquier County Schools, their first day back was going to be today. So for those of you all joining us that have, had children return from school, I hope everything went well. My name is Renee Norden. I have been the executive director of the Mental Health Association since December. Previous to this, I spent over 20 years working in high schools as a school counselor and guidance director. I've also worked as a suicide prevention specialist with Alan, and then also as a emergency services clinician. So went and evaluated individuals to see if they needed to be hospitalized because of mental health conditions. But I'm really happy to be here, and Alan is going to kick off this presentation, and I will follow up.
Thank you, Renee. All right. So, this first slide, let's take a look at today's agenda, just so you know where we're headed and what we plan to do. But I think it's an understatement in the introduction to talk about after a challenging year, because so much has gone on, and we've been living in uncertain and challenging times. And so, after a challenging 2020 and 2021 school year, youth are facing stressors, more stressors than ever returning to school this fall. And I know in all the community coalitions I'm involved with, the school people I'm talking to, everybody's been alert to this, trying to imagine what the schools may encounter when students come back to school. And so, they've been preparing, and there's still some uncertainty there. So in this workshop, we will cover warning signs your child or adolescent may be facing back to school, that they may be facing back to school stressors. This prevention work that I do, it's important to know warning signs, to be able to think if I see the sign, what's possible, and then consider what's probable. So, when I talk warning signs, I also like to mention that signs are things we see. And if you want to understand what's going on with a child or someone where you see a sign, it's important to ask questions and engage them in discussion and discuss what you see, and then you can determine if there are any symptoms. So I always like to lay that little foundation. So we'll talk about tips and tricks to ease back to school anxiety for students, not only students, but parents and educators. Everyone's involved. And so we'll talk about how to practice healthy coping skills with your children before returning to school. I like that concept. If I know fall year just started, but with other school systems, if you can address this beforehand, give them coping skills and that kind of thing, it can help when they do end up in school. And we'll also talk about self-care tips for students of all grade levels. Now, this is, I love this quote, but anxiety has always been high with this generation. With the pandemic, some students have become very comfortable with isolation, not having to deal with the anxiety that school might bring or their peers bring. That's what all districts are dealing with coming back now that these kids are together, giving them strategies to be able to deal with their anxiety, to deal with whatever mental health issues that they're struggling with. So, I always like some prevalence information to get an idea on, what issues may students have and how much of that's involved. So with this information from the Centers for Disease Control and Prevention, Children's Mental Health, you can see a breakdown by age for depression, anxiety, and behavior disorders. So this, this information is important. And, I do want to mention too, this is what is going on. And we know that that's out there, and any data or issues people have, young people, it can be exacerbated because of this pandemic. So when you look at these numbers, you can see this in the percentages, but 3 to 5, when you look at depression, the grades ages 6 through 11, shy of 2%, but 12 to 17, 6%. If you look at anxiety, you can see the lower age group, but as you evolve into that category, 6 to 11 over 6%, and 12 to 17, over 10% have an anxiety disorder. And then same for behavior disorders, age 6 to 11, you're talking about just shy of 10% and just shy of 8% for age 12 through 17. So bottom line is, we know that young people do have some issues with depression, anxiety, and other behavior disorders. And we're going to need to see how this what it's like when they come back to school, and be ready to address that impact. So, and then according to the CDC, mental health related emergency visits among those aged 12 to 17 increased 31%. Now that's in 2020 as compared to 2019. A significant increase in mental health related emergency visits. So according to the American Academy of Pediatrics, there was a significant increase in the number of emergency visits for suicide and suicide attempts in youth in 2020 than 2019. So, again, we always like to look at impact, but social emotional learning and mental health needs must be prioritized in order for academic learning to be successful. I mean, the fact is, when young people have emotional issues, mental health issues, it affects, and not in a positive way, typically, it affects their ability to learn, feel comfortable at school, and make a healthy adjustment. So, as we talk about those warning signs again, let's keep in mind, signs are what we see. We don't know symptoms if we don't check out what's going on. That's sometimes what makes prevention work interesting, because you may say, here's some signs. They don't necessarily mean something's going on. You have to check it out to see. So this is what is important. What's possible? Anything's possible in my years of experience. What's probable? I'm going to know when I check it out. So let's go over let's learn which behaviors may be signs of back to school stressors. And we're going to do this by, age groups, but preschoolers. How will I know if my child is experiencing back to school stressors? Preschoolers: thumb sucking, bedwetting, loss of appetite, behavioral regression, abnormal clinging to their parents, or sleep disturbances. When you look at elementary aged children, you might see irritability, aggressiveness, clinginess, nightmares, school avoidance, poor concentration, or isolation, wanting to isolate and be by themselves. And so with adolescents, you might see sleeping and eating disturbances, agitation. You may hear physical complaints. My shoulders are aching, my body aches, I'm tired. Delinquent behavior or poor concentration. And so what signs of back to school stressors should I be on the lookout for as a teacher? In the classroom, inattention and restlessness, attendance problems, disruptive behavior, difficulty answering questions in class, frequent trips to the nurse, issues in certain subjects, not performing like they normally would maybe in certain subjects, not completing homework, and, avoiding socialization, group work. Now, it's worth taking a minute. I always like to put myself in the role. So to me, in working with teachers, but in a classroom, typically we're looking for students to listen, learn, do what we're talking about, and not disrupt the class. And a number of these issues, when we do ACEs training or we do other trainings on recognizing warning signs of other issues, if you see or experience some of these, instead of a trip to the office, maybe a trip to the counselors for someone to say, what are you experiencing? What are you feeling? We care. We want to help. We want to know. So to open that door for some discussion, again, signs, symptoms. When you talk, listen, maybe these behaviors are tied to some issue that needs to be put on the table so it can be helped. It's critical. So, and teachers are the frontline people. So understand the possible causes or triggers for anxiety. A child experiencing obsessive compulsive disorder may have difficulty managing anxiety while at school. Here's some great examples. They're having trouble managing themselves, their anxiety in school. It affects their behaviors. And so we can determine that and help that. A child who has been bullied or experiencing drama may be afraid it will continue occurring when they get back to school. And so a child with separation anxiety might experience troubling thoughts when apart from their parents. So we need to be alert, engage, and try to understand. A child with an undiagnosed learning disorder may feel shame or embarrassment. So COVID, a new common cause for back to school stress. What can I do to help? You know, I got to tell you on that first thought, I just had a meeting today with the Culpeper schools through Healthy Culpeper. We had a meeting and they gave information. And the issue with mask, what the governor says, what CD says, what parents say, what the school board says. I mean, and it's coming down to we're back in school or we're back in school in a week. Some of this stuff in itself can create some anxiety. Am I going to need to do this? And that could be with parents and everybody. So what can you do to help? Let's talk about that. 5 tips to ease back to school anxiety. Start preparing children for the transition by creating realistic school year routines. You know, sit down, talk about this. What's it going to look like? What works well for you? What are some plans of action that you can stick to, and you know they'll give you, settle you down, keep you calm, you know it'll work out? What's worked in the past? So allow for peer support by arranging play dates with other students and friends, and maybe even visit the school before the year begins, and validate the child or adolescent's worries and listen non-judgmentally to their concerns, encourage them to brainstorm solutions and act on the best solution. So have that discussion. You know, what are worries you're having? I understand. So let's talk about what can be done. What can we do to cope with that? Let's talk together. Let's brainstorm some solutions, some ideas, and see what will work. And again, that's just teaching decision making. Get them involved. What's some options? What looks to be the best solution? Now let's talk about making that happen. So also inform school staff and set up an early meeting with their teacher, if that works. So strategies and tips to help your child or teen. Encourage your child or teen to take responsibility for setting a routine, sticking to a schedule, and getting back into the swing of things. These home discussions can be great to prepare, prep, teach skills, coping strategies, and practice them before they're in school. So help your child or teen set these realistic, achievable goals for the school year. You know, what are your goals? What do you want to achieve? How are we going to go? How are you going to go about that? What steps are you going to take? So talk through any issues or fears, offer support, and always know when to ask for professional help. You know, if your child can't get calm, the fear doesn't go away, nothing you do seems to work, maybe it's time to get some professional help and look at that. So, and encourage your child or teen to focus on the things they can control. You know, it's easy to get lost in this thing of, I can't control that. I don't know what to do about that. Well, let's talk about what you can control. Let's focus on that. So the do's and the don'ts of helping your child. Do help your child manage anxiety. Work with them, talk to them, give them ways to do that. And do express positive, realistic expectations. Now, I got to go back to that resiliency presentation where these positive emotions versus negative emotions. Positive emotions help people bounce back, stay calm, become great problem solvers. They can't do that when they're worked up and having all these negative emotions. So keep the positive emotions flowing. Do respect your child's feelings, but keep moving them to that positive emotion. Do model healthy ways of handling anxiety. Model what you're talking about. You know, do think things through with your child and encourage this positive self-talk. You know, we've talked about that in the resiliency too. When they're doing something well, they accomplish something, they're making progress, teach them to pat themselves on the back. You can do it for them, but help them say, hey, I did good. I feel good about that. That helps that self-esteem and self-confidence to grow. And it's not bragging. it's positive self-talk. It's necessary. So don't avoid things just because they make your child anxious. Put them out there, help them cope, teach them ways to cope. Don't run and hide because they're going to have to do this ultimately. Help them do it. Don't ask leading questions. You don't look happy. What happened at school? Oh, what are you feeling? What are you experiencing? How did your day go? And that's a good check-in right now. Do the check-in, check out. You're checking in after school, and okay, what do we need to do for tomorrow when you go back? Don't reinforce your child's fears. Always look toward, hey, we'll find a way to get this straight. There's a solution to this issue. Let's talk about it. Let's make a plan. And so don't ignore your child's concerns. Talk about them. I'm concerned, you're concerned. Let's talk about that. And then, cut to what is real, what needs to be done. Help them work through these concerns. So what should I do as their educator?
Hey, Alan, you want me to take this?
You go for it. Thank you.
You're welcome. Okay, so as your educator, and understand, of course, educators are more than just teachers. They're also parents and grandparents and significant others. So there are lots of things you Okay, and so this quote is fabulous. The thing it really points out is that a lot of the mental health care that children receive is actually done within the school system. So there are supportive adults in the school system that can help if there are things going on at school and at home. So we want to remember to validate and support and listen to our students. I know sometimes as educators, especially, in your first week, it seems a little overwhelming, but it's your job to find their stories. And if you know their stories, the students are much more able to do well in your class, identify with you, actually be more compliant in class. So learning their stories goes a long way. You need to be honest and encouraging. You need to talk to them about what is possible and what is not. Is it possible for them not to do any work in your class and pass the class? Well, no, probably not. Just like you have to work in the, outside, out of school, you have to work also in school. And then for some who are really anxious to begin with, Alan talked about that avoidance. We want to make sure that they lean in. They take a gradual approach to addressing that anxiety or that avoidance. And then as Alan also shared, we want to praise and reward our students, but we need to be careful. We know that false praise does more damage than just not saying anything. So if a child knows that they haven't done well and you say, oh, you did a great job, they know that you aren't being honest. So you can say things like, I really like the way you did the intro on that, but I think maybe that second paragraph can need some work. Those students are already going to know those things. So we need to be honest with them. We want to, model good behaviors. If you are a person who likes to hide when there's conflict, that isn't really modeling good coping behaviors. We don't have to, get up in someone's face, but just showing how you can have honest, open communication, modeling that is a great thing. Being calm. As people start sort of the frenetic energy in your classroom or at your house starts expanding, getting into that calm, talking more in a calm manner is a fabulous gift to give everyone around you and yourself. We want to make sure we know the policies that our school has about the COVID procedures, and then we need to follow them. This isn't that, oh, it's okay to have a cookie, it won't ruin your dinner. The reason why some schools require masks and some others have it as optional, just know that, COVID is a real thing and we want to follow the rules that the school is going to provide you with. And then one of the things I talk to a lot about adults is really caring for yourselves. You know, as the airline says, you know, if the oxygen mask falls from the ceiling, put your mask on before you put it on those around you. We need to do the same thing, because if we keep taking energy out of ourselves, keep taking that fuel out, we are going to have less to give others and be less effective. Part of this is practicing your own coping skills. For educators, they can do this, and parents. I love this picture. I think it really shows how you can incorporate your children in some of your practices. And so, of course, meditation, yoga, not only as your own, but also as your child's daily care. I was talking to a young person, I think he's in 2nd grade. And so I was talking to somebody about deep breathing, and he was like, wait, is that when you go in 1, 2, 3, 4, out 1, 2, 3, 4, 5, 6, 7, 8? And I was like, yes, where did you learn that? He said, I learned that in school. And I was like, well, let's practice it. And so it is amazing to me that it works so well. So that deep breathing, that, you know, pretty quick inhale and then that long exhale, you do it 3 or 4 times, and it interrupts that parasympathetic nervous system, that fight or flight. And all of a sudden you'll feel yourself calming. So if for you, as you know, parents or caregivers, if those first couple minutes when they get off the bus and come running in the house is one of those things that causes you to feel a little anxious, try a little deep breathing before they walk in the door. Allow yourself to be really calm as they come home. You want to openly discuss emotions. I remember the first time, so I started here in December as executive director. A couple weeks ago was the first time that I had my board, right, my employers here in the building in person. And I was sharing with Stephanie that, you know, I was feeling a little anxious because all of a sudden I was going to meet all these people in person for the first time. And so I was like, and so this is what I'm doing. If you all haven't learned the Superman stance, I encourage you to look it up on YouTube. That will help you prepare for those anxious moments as well. Tons of data on how that's effective. So Superman stance for 2 to 3 minutes before you have a challenge. Great way of addressing that challenge. Alan already talked about focusing on the positive and what you can control. Daryl Bellamy, who the Mental Health Association, with the help of PATH, we brought him to talk to all the high school and middle school students in Fauquier and Rappahannock counties. Through his research, he discovered that 80% of what we worry about never happens, right? So as you start worrying about something, the first thing I want you to ask is, do I have control over it? And what is the probability of this actually happening, right? We don't want to need to waste the energy on worry. Establishing and maintaining daily routines is a very powerful protective factor for our students, for our children. They need consistency, especially in this time of COVID, when kind of consistency was ripped out from under us. So consistent time of getting up, of eating, consistent things in their lunch. You know, consistently, if you say you're going to be there, you're going to be there, or you're going to leave a note or something saying why you weren't there. Those consistency. The other thing was sleep patterns. Sleep is so powerful of regenerative force that we need to make sure our students know how important that is. I would encourage you to keep all electronic devices out of their bedrooms, get them off of them an hour before bedtime to help with that sleep pattern. And then if you're trying all these things and your young one is still experiencing difficulty, I would encourage you to reach out. Reach out to the teacher, to your school counselor, to another mental health professional to get help. If I had a magic wand, I would have every middle schooler go to counseling. I think along with the stigma about mental health, there's just this idea that counseling is somehow difficult, somehow, you know, you aren't prepared for it. The people who are counselors, who are trained in this, their job is to help you get everything out of your head and kind of put it on the table, talk about it, and decide what you want to pick back up. And so the trick is also to know that when you seek additional help, you know, you can start with your pediatrician, another individual counselor. People, this counseling thing is a relationship. And sometimes you might start with a counselor that you don't have a great relationship or you don't form one with. I encourage young people to go at least 3 times. And if they don't feel that connection, then find a different counselor. All right. But counselors are there to be supportive, to help. And the earlier we can get someone who needs help into counseling, the easier it is and the shorter amount of time usually it takes to get better. Right now, the stats say the average amount of time an individual waits is 10 years to get help. I really want to reduce that. I mean, imagine suffering for 10 years before getting help. So the earlier we can do this, the better. Self-care is something you have control over. And so I encourage you to think about how you care for yourself. Because in caring for yourself as an adult, the children, those young people around you will see that it's important. All right. So children can then identify their physical and emotional needs. We talked right already that, by modeling this, it allows them to see that this is something they'll do over the course of their lifetime, and it will help their future selves. I know when we have children that we don't want them to leave us usually, but understand our job as parents is to help them become independent, and self-care is part of creating that independence. It will also help them stay physically and mentally healthy. Now, Alan is a big proponent of resiliency. I know he's done a number of talks on it. And resiliency is that ability to bounce back. It's that grit factor. Sometimes we feel this need to shelter our children. That goes directly against creating resiliency in our children. If we try to do things for our children, it gives them the message that they can't do it themselves. And so we want to make sure that they know they can and become independent, functional children. Alan, do you want to say anything about resiliency?
No, I'm going to let you do it because I've done it enough and I don't mind putting it in, but I want to give you an opportunity because I know you've been hearing the presentations. I think you're very capable.
Well, thank you.
I believe in you.
Thank you. See, that was a very positive message on Alan's part. So that bounce back. And so what that is, where we say resiliency skills with time. For our little ones, we want to start with manageable things. Like there's no way I'd turn to my 2-year-old and ask them to take the car to Safeway to get milk, right? That wouldn't be developmentally appropriate. But it could be that I ask them to pick the socks that will go with their outfit, right? Or maybe as they're little, I always, create 2 outfits and they get to choose which one. And as they get older, maybe I encourage them to, teach them how to set the table. You set it with them for a little bit and then you observe when they set it and then they are masters at setting the table. The reason we want to give them these skills is that when they go outside of our house, then they are confident and capable, right? We want them to feel like we've equipped them with the necessary skills. An easy example of that, when I was 16, I got a real clunker of a car. I came out the next day and one of my tires was flat. So I went in and told my dad, and he came out and he showed me how to change a tire. Okay, great. Next day, came out, another tire was flat. We did find out that the tires that were on the car were not the ones we had actually seen on the car. So they had switched out all 4 tires. But so I went back in and said, Dad, my second tire is flat. And he said, well, I'll come out and watch you change it. And so I changed the tire with my father's guidance. And then 2 days later, when the 3rd tire was flat, I went in and said, Dad, my tire's flat. And he said, why are you telling me? You know how to you know how to change a tire. Now I bring that up because later in life, when I was probably 26, I was in a car, my friend's car. The tire went flat. We pulled over way off the road, so we were safe. And she picked up the phone and called her dad. And she said, Dad, my tire's flat. And he's like, well, okay, it'll be an hour before I get to you. And I was like, what? I said, we aren't waiting an hour. We're going to change the tire. And she's like, how do you know how to do that? So I encourage you to equip your children with these skills, because when they get those feelings of competence, it develops that resiliency. They know that they can be successful. They know it's kind of difficult to learn things, but then they know once you've mastered it, it becomes easier. So we want to set up these small little learning tasks and have them get bigger as time goes on.
And so Renee, I do want to say one thing, and I know you don't mind, and it ties into exactly what you're saying and ties in the presentation. Sometimes when our children are doing things and it doesn't work out, we tend to go, oh, that's okay, don't worry about it. It's an opportunity to talk to them about what they could do different. Don't beat yourself up. You're not a failure. And you teach them the process of learning and growing and using that perseverance to keep trying, but do things differently instead of doing the same thing over and over. Try something different, think about it, problem solve. So you turn those, what could be a bad thing, into something very positive. You know, it didn't work out. Oh, so what? What do we, like your follow? So what are you going to do? I'm going to go back, look what I did. How could I do it different? And I'm going to learn and grow. Maybe I'll get professional help from somebody, someone who's been there before. So it helps young people take on challenges, not feel when something doesn't work out that they're a failure. Hey, I need to go back and work a little harder, or check it out, do something different. So good opportunities.
Right. And this will help them manage their stress levels and other challenges as they, you know, throughout their life. But for young children, you know, sometimes you feel like, well, how do I do this? And so, you know, we talked about setting the table, but also, you know, how to brush your teeth, how to, you know, pick a good snack, talking about emotions we've talked about, work their minds. You know, I have to laugh because as a parent of young children, you know, I sort of was like, okay, and this is how we're going to do it. And one day my oldest went, why do we have to do it that way? And that was my aha moment. I was like, wait, we don't have to do it that way. How would you do it if we were doing this? Right? And so let them figure things out. Let them try new ways of doing it. It goes, I mean, so much better in the long run then. Of course, we want to model being active. I know that the American Pediatric Association wants young people to get 60 minutes of exercise, moving around. And so I'd encourage that. I would encourage them, you know, of course, we will keep you, you know, that we sort of thing keeps you active, but I'd also encourage you just to get active outside. You know, move around, get active with them. Take like a walk after dinner or something that gives you together time, but also keeps you moving. And that downtime is really important. I'm not sure I would call video games downtime. So be careful of how much screen time they're spending. There's a whole bunch of research now going on in screen time and the actual physical changes that are happening in young children's brains because of screen time. They don't know what that really means yet because we haven't had cell phones and, you know, those types of screens for that long. And just interact with your children. Find out who they are as people. You know, don't always think you need to be the lesson teacher or the teacher in this. Allow them to teach you things as well. As teens and adults or adolescents, understand that they are supposed to be getting independent. They are supposed to be pushing your boundaries. In fact, I was more concerned when I had students that weren't pushing boundaries about those students than I was for the students who were pushing boundaries in a healthy way. Okay? So allow them to figure out what they love and figure out how they want to develop that. Getting active. Sometimes that's organized sports. Sometimes that's individual sports like running or walking. I even have had a student that took up archery, but something that allows them to get out and about and have feelings of competence. Yeah, we've already talked about being careful with technology that occurs across all age levels, even ourselves. We have to be careful about screen time. I'm really excited to see students volunteering. I know that some schools require volunteer hours or some organizations require volunteer hours. I want those volunteer hours to count. So I want them to be in areas that interest them. And here in Fauquier, we have the Path Foundation Let's Volunteer that gives you just tons of different volunteer opportunities. The reason why I want it to matter to them is because I don't want them just to be checking off boxes. Like, I've done an hour of volunteer work. I want them to have some sort of significant interaction in something they like, because it really helps them develop as people. Hanging out with friends is great. We want to make sure that we aren't trying to engineer that too much. Teens and adolescents will not like it if you try to arrange play dates for them, right? Oh, I've arranged for you and Johnny to hang out on Friday. That will not go over well. But if you say, hey, why don't we go to, Crockett Park? Do you have any friends you want to bring to Crockett Park with us, and we'll, do the boats or something? That allows you to have a little interaction with their friends. At the same time, they have their own independence. It also allows you to become more of a cool parent in a good way, not a cool parent in a permissive way, right? At this time, I know that we really want to be our kids' friends, but that's not our job. Our job is to be their guardian and parent. When they get into their 20s, late 20s, you can be more friends. But right now, you still have to be that person who provides those boundaries. Healthy sleep habits. I don't understand their sleep habits. I worked with high schoolers for 21 years. I'm not sure why they stay up until 2 a.m, but it just happens. And so figuring out how to help them sleep is a good thing. And then fun activities. I think a lot of times when kids get into their teens, there's a focus more on, well, what are you going to do next? Okay, think about it. When you were in 9th grade, did you know what you were going to do? And if you thought you did, are you doing that right now? The odds are not. Probably probable that that's happening. So have activities that just get you together to have fun. And so that is the end of our presentation. These are extra resources for you. The Mental Health Association of Fauquier County. We serve predominantly Fauquier and Rappahannock counties. This is our website. If you're interested in information about mental health and substance use, or about mental health providers in our area, we have a searchable database. And so please come to our site and look at that. If you want further referrals, feel free always to call us. The Child Mind Institute is a underused resource. Fabulous topics there on anything you can think of having to do with children. Even if you think that no one has ever gone through this, I bet it's on the Child Mind Institute's website, and Understood is just really talks about how to really have conversations.